Hello and welcome to the Beacon Way podcast. This is Ken Okonek, and I am so excited to be going over our blog today and sharing with you the value of VOI, no pun intended, value on investment in behavioral health marketing, and understanding really the differences between value, VOI, and ROI. Because a lot of people know the ROI thing, right? But they're not really understanding the VOI. So most agencies really focus on that ROI, and there's a lot of depth that can go into that. And you've probably seen some content of ours on that before. But we got to understand the difference of ROI and VOI. And so we've already explained what ROI is, understanding how to break that down, in the short side. But what we want to be able to understand is there's this whole thing called VOI, and knowing that the value of what you're doing probably far exceeds just the revenue you're generating that month. So focusing on a holistic impact, including patient outcomes, brand reputation, community trust, and employee morale. An example, a client invests $10,000 into a community health awareness campaign. While direct patient signups are modest, a low ROI, the campaign leads to 30% increased website traffic for educational resources, a partnership with local school districts, and overwhelmingly a positive social media sentiment. That's demonstrating high VOI. And I could even expand on that. We've had clients all the time that are focusing on their web traffic, but not their quality of conversion of web traffic from the value of the marketing that they're doing. So a really good way to do that is using an SEO conversion model. So, if you say 3% SEO conversion. So for every 100 people that are visiting your website, 3 of those are turning new clients off of your website from that SEO. You should be able to put a value or a VOI campaign in place and see that SEO go up. So what if traffic increases and you increase your SEO conversion by 1%? That is an insane number to think about, right? So if we go off the 100, right, and you were at 3% and you go to 5%. So say you double your traffic, web traffic, which is a typical case study for us, right? Double, triple, quadruple their web traffic. So you go from 100 to 400 and you go from a 3% conversion to a 4% conversion. You're now getting, instead of 3 people out of 100, you're getting, 16 people from that website. That is an insane jump. And all we talked about doing was shifting from, an ROI component and metric to VOI. So just kind of explaining why it's so critical in the behavioral health clinics. Here's why VOI is particularly relevant in your guys' practices. Aligns with patient-centered care. The most important thing, and most likely why you guys got into this, is you're trying to help people. You wanted to bring as much value as possible. Your primary goal is to improve patient lives. VOI measures that indicates that, like patient engagement, satisfaction, improved outcomes, which are direct reflections on your mission, most likely. Builds trust and reduces stigma. This is also such an important part in your guys' space, is education and understanding truly what you do versus what people think you do. Enhance brand reputation. A strong positive reputation is one of the most valuable assets. VOI helps you measure the impact and efforts of enhance your brand as a compassionate expert and trustworthy provider in the community. Improve stakeholder communication. When communicating with the board members, investors, and community partners, VOI provides a complete picture of the organization impact. It demonstrates that you are making it not just because you're centered, but your strategic driver in your mission. So how do you measure VOI in a behavioral health marketing? So improved patient outcomes and engagement. So what we're going to do is we are going to look at this from patient education, intake of onboarding experience, and patient satisfaction scores. All very simple things that you can do and put metrics into. Again, most of our clients, unfortunately, do not have really good, solid tracking metrics around that. So getting on top of that with an agency is really important. And then you enhance and first the brand reputation and trust. So online reviews and sentiment, very simple, right? A lot of people think of just Google, but there's a lot more that goes into that. Media mentions and features and website authority. So that has to do a lot with your website, back end of your website, and overall how your website is ranking. And then increase community well-being. Your clinic is a part of a larger community ecosystem. Marketing efforts that strengthen the community generates in significant value, right? Community partnerships, so B2B, expansions, referrals, event attendance and engagement. which can create content, which can also be, again, a perpetuation of all of this. Local searchability for help-seeking keywords. So all that local SEO, Google Business Profile, showing up on maps is going to make a huge difference in that. Actionable steps from implementing VOI measurements. So define your value goals. So work with your leadership team to define what value means for your organization. Beyond revenue, it's a community education, stigma reduction, becoming the top regional resource for adolescent care. Identify VOI metrics. So based on your goals, choose 3 to 5 VOI metrics that stack. Start simple. You might choose track website engagement with educational content, social media sentiment, number of community partnerships. Investigate VOI into reporting. This really has to make sure you're getting the right data in the right channels and it's accurate. Lastly, it's important if your data is so far off and you want to implement something like this, that whatever you're doing, you're remaining consistent in your data. You're not changing it all over the place, because changing data that is not accurate and consistent will not be valuable. And then tell the story behind the data. So all of that data will be able to create a story for you to adjust your marketing to put it out in the marketplace. Conclusion, a more meaningful measure of success. In behavioral health, your impact measures is changed lives, not just fulfilled appointment slots. While ROI remains a necessary metric for financial health, value on investment offers a more complete and meaningful way to measure the success of your marketing efforts. By tracking improvement in patient engagement, brand reputation, and community well-being, you can demonstrate the true holistic impact of your work. The approach not only justifies marketing spend, but it also aligns you to grow strategies with your core mission to provide compassionate care and build healthier communities. Start by defining what value means to you, and you will unlock more powerful ways to measure the community of your success. If this is something that you have more questions on, or how it directly correlates to your business, or how you could help calculate with it, don't hesitate to reach out. We are more than willing to bring as much value to you as possible, because again, like I said, I talk to so many business owners and they don't have their numbers. And I ultimately want you to have your numbers, because once you have your numbers, those numbers don't lie, and you're going to be able to find the biggest opportunities in you helping more people in your community. Look forward to seeing you guys in the next one. You have been listening into the Beacon Way podcast. Make sure to join us for new episodes every week. Don't forget to like, share, and subscribe to the Beacon Way on Apple Podcasts, Spotify, or wherever you listen to podcasts.